Good morning, students. We have now, as all of you are doing, we have now started some electronic classes. We are using the electronic means of communication to enhance and propagate the learning process. And today I have already sent you a PowerPoint, and I'll just emphasize on some of the points that I would have liked to talk during my class. Now, as you know, we were already doing identification, and in identification there are some topics that we have covered. At the moment we were doing something about the age determination. Now, identification, as I have already repeatedly told you, that identification will have 4 aspects, one of which is the identification of a living person, the second of which will be identification of a recently dead person, and third will be identification of a remotely dead person or a skeleton, and or maybe mutilated and decomposed bodies. So for this identification procedure, there is also another aspect, the aspect of teeth, which has an immense importance. Now, specifically for identification of a person as a whole, it may be used, or it may be used for identification, or rather determination of age, which is more likely. For the identification of an entire person using his tooth, definitely these are cases where which you will find in case of a mutilation or advanced decomposition of bodies, or in a remote dead person where we have only found the skeleton, or maybe we have only found a single tooth. There, from DNA mapping, etc., the identification is done by forensic experts. Similarly, in case of where a mutilation of body has occurred, sometimes the body parts are scattered in different places. So from there, from the head part, if a tooth is extracted, if we find a tooth, then the matching, the DNA matchings, etc., can be done. But in the case of determination of age, which is very frequently required even by the normal practitioners, is that age can be very well determined by the settings of the teeth. Here the very first thing that I want to tell you is that we all more or less we have an idea that human beings will have 2 sets of teeth. One is called the milk teeth, or the temporary teeth, or the deciduous teeth, while the other is called the adult set or the permanent set of teeth. So we know that usually when a baby is born, when a child is born, the child will have no teeth. But the rudiments of both the temporary teeth as well as the permanent teeth remains within the jaw during birth, which is formed at about 3rd or 4th intrauterine life, as early as that. Slowly, gradually, as the months pass by, from about the 6th month of life, life of a child, that is when we call it an infant, there the teeth will erupt. The very first, you have also received a PowerPoint presentation where very specifically you will find out the time, the chronology where the teeth are erupting, and usually it is seen that the first to erupt the first temporary teeth to erupt will be the lower incisor, which will be followed, which is about 6th or 7th month, which will be followed by the upper incisors, then the first molars, and then the canines, and next the second molars. The temporary teeth or deciduous teeth, as we know, shall be 20 in each jaw, which is 4 of them will be incisors, the central incisor and the lateral incisor of each quadrant. When we make 4 sections of the jaw, then we get 1 quadrant. So we will have 2 incisors in 1 quadrant, then we will have one canine and 2 molars. So that will make 5 teeth in each quadrant. The quadrants, as you can understand, will be upper left, upper right, lower left and lower right. You can even, if you see a mirror, you can just check it out yourself. And so those teeth will be, that way it will be arranged. The arrangements you can very well see by yourself, or the PowerPoint will definitely help you out. And these teeth will, this dentition, this temporary dentition or milk tooth will, the eruption will usually be complete by the 3rd year of life. And from about the 6th year of life, again, these will start to fall out. Now, regarding the temporary teeth, the incisors, you have to identify when you are, suppose you are seeing a child and you are trying to determine the age from the condition, from the dentition, then you must be able to identify which type of teeth it is, whether it is an incisor or whether it is a canine. Only then you will be able to determine what age this child belongs to. And in case of children, it is very important, because sometimes it may happen that in rural population, in the illiterate, in the low socioeconomic group, you might have the parents who are not able to correctly give you the age of the child, or it may be that the child is lost somewhere or is brought by foster parents, or anyhow you don't have any means of determining the age, where this dentition will help you out a lot. So you must be able to identify which type of teeth it is. So the very front teeth are the incisors, as you know, and they are usually chisel shaped and convex on the inside and concave concave on the inside and convex on the lip surface. Then we have the 3rd teeth in any quadrant will be the canine, and which is a conical teeth, and it is usually the longest teeth. Whenever anybody opens the mouth, you will see that 4 teeth will be little longer than all others, and those 4 will be the canines. And the incisors and the canines both will have single root. Then we will have the premolars. Then we have the molars, and the molars are usually the bicuspid in case of the children, in case of the deciduous teeth, and they are more or less flat teeth with 2 or 3 cusps. That is, the crown will have undulations on it, and that way, and it will have 2 roots. So that way you will be able to recognize the teeth. And so that is about the morphology of the temporary teeth. And as I've already told you, about the age of 3 years, the children, each child will have 20 teeth, and from about 6 to 7 years of age, these teeth will fall off, usually in the pattern that they have erupted. You will also find that the falling out of the teeth has been chronologically arranged in your PowerPoint presentation, and you have to go through it. And so these are the informations that I wanted to share right now, and I hope all of you are doing fine, and you have to stay home, you have to stay healthy. Thank you.